Welcome back to the VET S.O.S podcast, brought to you by the Who You Know Network. Don't drown the sea of transition. Grab the VET S.O.S Lifeline. I'm really excited about this one, Mark. We got Jim Zenner with us. He's the director for military and veteran affairs for Los Angeles County. He's got some amazing things that he's doing over there. So I can't wait to hear about this and really hope our veterans out there in LA County get to sit in and watch this one and get involved in it. As always, I'm here with my old/new co-host, Mark Elder. Mark filling in for Eric while he's away. How you doing today, Mark?
I'm doing great. Hey, good morning, VET S.O.S Nation, or good afternoon, maybe I should say. Thanks for joining in with us, and great to be back. Great to be here. Super excited to hear and talk with Jim, talk with Jim. But yeah, excited to share some screen time here with you too, Shawn. So it's been a little while.
Absolutely. Great to have you back in the jump seat. All right, so let's jump right into it. We got Jim Zenner with us. He was appointed as the Director of Military and Veteran Affairs by the LA County Board of Supervisors on August 29, 2022. Jim most recently worked for the LA County Department of Mental Health as a mental health program manager. In this capacity, Jim was responsible for the implementation and oversight of the Veteran Peer Access Network. Jim's prior experience include working for the U.S. Department of Veteran Affairs and Director of Homeless Veteran Programs for VET Advocacy. Quite the legacy there, Jim. Love seeing what you've done in the past and what you're trying to do now. How you doing today?
Great. Thank you so much for having me, Shawn and Mark. Look forward to the conversation.
It's awesome. You have a great story in the path that you've taken here. So why don't you fill it in a little bit for us? Tell us a little bit about your journey. You know, what made you get into veteran homelessness, and how did you find yourself moving that direction?
Yeah, well, I would have never got this career path if it wasn't for my stint in the United States Army. So I was 26, managing restaurants, and I had a dad who's a Vietnam vet, and I was thinking, man, that's hard to get drafted. That's a difficult thing, and I don't want any my fellow countrymen having to get drafted. So I told my dad, like, if they start talking about a draft, I got to do my part, and kind of live down the family legacy. My dad served in Vietnam. My grandfather fought in Guadalcanal, and it's kind of a family business for us, like many Americans. So, at the young age of 26, I depped into the Army, went out to basic training right when I turned 27, and so did my 4 years active, got out, did 3 years reserve, and when I was in the reserves, I knocked out my master's of social work at USC, and for me, coming back, it wasn't like a lot of us, just having some difficulties. My wife not understanding me not understanding my wife, basically led to me staying in a homeless shelter for about 7 months. And, during that, the nonprofit that helped me out, they turned around and asked me to help them out and speak at some of their engagements. And so, of course, many of us that serve in the military, just service, and somebody helps us, we're definitely going to return the favor. And so it was one of those things, and did some speaking for them. And then they had this brand new facility that they just got the grant from the VA for. And it was for Iraq and Afghanistan vets who were, having difficulty with housing instability. And, many also had, mental health issues or substance abuse issues, things like that. And it wasn't a full blown dependence. It's just struggling to figure out our way, and a lot of us had, issues with alcohol, our relationship with alcohol. Some had, troubling relationship with drugs, but, some came in and it was just a struggle, just figuring things out. They were used to an E6 lifestyle financially, and they got out and plans didn't pan out, or they misjudged the budget of the GI Bill or the allotment of the GI Bill and housing costs in LA, and they just fell on hard times. But it was my probably one of my favorite assignments in my career, is just helping guys that were maybe 6 months behind me and figuring things out. And that's really kind of how I landed into homelessness, working in homelessness. From there, it was kind of, peer support, mental health. I always had I was always drawn to mental health. My dad struggled quite a bit. 19 years after the war, he was unable to work anymore all of a sudden. And life at home got really, was changed dramatically once he started experiencing his issues. And watching him kind of fight through his own stuff, it just made me have an appreciation for the helping profession. And so when I was in the service, I was like, maybe law enforcement, maybe helping professional. You know, I was knocking out psychology classes, and I couldn't stand the thought of, like, you know, doing, you know, policing in the community that I live in. It's a really tough job that we ask our men and women in law enforcement to do. So I ended up going with the helping profession. So that was kind of what guided my career. Those two instances are really kind of pivotal pieces in my pivotal times in my timeline that led me to homelessness.
Well, so talk to us a little bit about, like, the help that you got, right? You find yourself now like a veteran. So you went from restaurant, right, to the military, and then now as a veteran, kind of back into like this position where you're not where you want to be. What kind of resources and things did you find? What was offered at that point?
Yeah, I mean, you know, like a lot of us, you know, I was, you know, coming back, I, you know, had some intrusive thoughts, some, you know, things just sit in front of the Christmas tree and my kids are opening presents and I don't feel a darn thing, and just kind of, you know, kind of working through some of that stuff. And the big piece was my dad. I would turn to my dad and, like, hey, Dad, is this normal? Like, you know, I just feel really, I'm not the same. He would guide me through. But what really kind of had things unravel for me is when he died unexpectedly 6 months after I got back from Iraq. And then, you know, just he was going to throw a barbecue for me and my 5 guys that were in the squad. You know, one was taken off to Hawaii in the next assignment. One was going home to Indiana. One was going back to Fort Huachuca. And so, you know, had this great barbecue plan with all my buddies. And, you know, I get out of physical therapy at Madigan Army Hospital, and I turn my phone on. I get this message that my dad passed away, and it was completely unexpected. So that really is what kind of precipitated me into needing help. You know, at first I was just trying to white knuckle it. Things were falling apart pretty quickly for me. And I was actually interning at Madigan Army Hospital in the intensive outpatient program. And I had to take a leave of absence for a couple of weeks. And then I actually reached out to him and said, hey, you know, I can't continue to intern, but can I get services there? And so they, fortunately let me come in as a patient the last couple of months that I was in. So that's what started my help. And then my wife and I moved down to Los Angeles in August of 2008. And that was just another kind of issue for me, just moving away from all my friends and family. It was my wife and my 2 sons. And, you know, we just weren't getting along. I blamed her for everything. She was like, who the heck is this guy? You know, she had a sister that lived down here, but she didn't have all the social networks that she had when she was going to UCLA prior to when we met. So things fell apart, and really, you know, I got a lot of help from the VA, a lot of good, solid help. I'd say the most helpful thing for me is when they sat me down and said, hey, you're in the right place. We study this, we research this. You know, all we think about is guys like you, and you're in the right place. We're going to be able to help you. And that, I remember that moment. That was fall of 2008. And yeah, that just helped me understand that I'm in the right place.
What a godsend, right?
Yeah.
What a godsend.
That's kind of caught me off guard there. I didn't know this part of the story. That's a phenomenal story for how you got to where you are now. The completely unusual road, obviously, but for your current position. But the fact that you've taken your experiences and the help you've received, and you turned around and you gave back into that, and you supported that, and it became essentially part of your life's passion, it looks like. Just completely applaud you for doing that and seeking the help. We talked to so many today that still don't want to seek the help, don't want to get the required help, and we beg that they do. So I do applaud you for that. So as you did that, you wound up working for the LA County Department of Mental Health. How did you transition into that? Was that a stepping stone from like the VA stuff you were doing? How did you wind up there?
Yeah, so I was with the nonprofit that helped me out for a good 6 years, developing programs, started a peer support program, oversaw a HUD-VASH program, and there was an opportunity to start a mental health clinic over at USC. And So I did that for about a year. That was for veterans and their family members, and transitioned from that job over to the VA. And I was at the VA for about 8 months. And right as I was starting my job at the VA, the county was looking into developing a program that really leverages the lived experience of veterans to really kind of make sure that veterans aren't falling through the cracks. We know about 10% of our veterans in LA County, of the 252,000 that are in LA County, are not eligible for VA healthcare. And sometimes it's, they just kind of screwed up and got discharged from the military. But I run into many men and women that were discharged because of the don't ask, don't tell, or, that draconian policy around LGBT. Veterans that got medevaced out of Iraq and started taking pain medication, or prescribed pain medication, then started drinking a lot, misinformation, and just outstanding individuals who gave their country everything, and because they didn't get the treatment while they're in the military, they end up struggling and languishing in LA County. And so our board saw that gap and started moving towards creating what's called the Veteran Peer Access Network. And the county executive team did a search of who's got the skills and talents to take this off. Unfortunately, they found me and recruited me.
Now, was that still with the VA or was that with the county then?
So that was at the county. Yeah.
The county. Okay.
Yeah. And so I started July 2nd, 2018 with the Department of Mental Health. And that's kind of how I ended up there. And at the VA, I ran the biggest peer support program in the country. So that my experience really matched what they were looking for. Yeah.
So what's the VA, maybe because regionally, I mean, here the VA is great, right? The Dallas VA, and there's one in Bonham. And I mean, the system is pretty well organized now, right? Much more than it was. And we know some of the issues that the VA has had, but maybe regionally or in California, like we know homelessness, not so much maybe here in Dallas, but Austin, right, has his big homeless problem. We know LA County and certain parts of California do. Like, is the VA doing anything with homeless?
Yeah, that's a great question. So they are. They've really brought their A team to LA County to address veteran homelessness. John Kuhn, who started the SSVF program, which is really kind of one of the most innovative and flexible programs attacking homelessness. He's now the second in command at the local medical center. The secretary brought on a special advisor who was the executive director of the homeless program office. Great guy, Dr. Keith Harris. He's been doing some advising here. And then really their medical center director, who recently got put on assignment up to Vision 22, is just an all-star. Just a guy that just listens to the community, responds like really well. And I mean, because the VA's brought their A team to LA and really focused on making LA the center point of innovation, like they want to figure it out in LA, and then they're going to take that model throughout the rest of the country where appropriate. We've been able to do a lot of great work. And, the great thing is my board, my 5 elected officials that I report to, they're just charged me with, hey, we need to be a great partner to the VA. There's no finger pointing here. We're not looking at, we're not blaming the VA for not funding this, funding that. We're going to show up and we're going to get it done. And so we got excellent. I just saw a bomb pop up. That's
that's a bomb drop right there. Well, it's great to hear that. And that was my next question actually, is what is the relationship? Is there a relationship? And, we were just talking in a previous episode about community and how we're all passionate, right, about supporting and making an impact in the community. But I feel like there is an opportunity, and I'm grateful to hear that the county and the VA and these organizations are able to work together, right? I think that they need to. That's the only way it's going to work.
100%. Yeah. And counties play such a big pivotal role. I've been talking to folks about looking at creating a national toolkit for counties to collaborate with the VA.
That'd be awesome.
Just kind of, coming up with a blueprint because we do so much as a county. That's where the services are. Like in LA, how it works is county is responsible for services, and we partner with the cities to provide those services. And so there's just a lot of like federal funded programming that we do that, should absolutely be tied in. And the big problem is just, in LA, we got, 10.2 million people to take care of, and breaking down subpopulations can just kind of confuse the system and all that. So what I'm really looking to do is just methodically working with our department heads, really kind of create an MOU and kind of an understanding and approach, a unified approach towards veterans, but really doing the heavy lifting on our side as much as possible, because yeah, it's just for them, it's kind of, it's hard to break away and create, different subpopulations, because there's so many competing priorities in LA County. But
yeah. And it sounds like you guys are doing a good job at metrics, right? At tracking and looking at the efficacy of the program. Tell me a little bit more, I guess, or tell us a little bit more about like how you guys are tracking compared to what your goals are, and then how you might be able to get to where you want to get to, and what the community can do to help that.
Yeah. So we have all sorts of ways that we're tracking data. With the Veteran Parent Access Network, they use a platform called Unite Us. But what we're looking at is referral times. So how long it's taking once somebody asks for something to get that service. We're looking at what people need. Are they coming to us for food insecurity, housing, mental health, whatever it is? So really kind of looking at, what people are coming to us for, and then the wait time to get it. And then our assumption, if things are working correctly, if it's taken 2 weeks for mental health, but it's taken a day for employment and food, maybe we need to invest more in mental health. So we're looking for those gaps. One thing that we don't have down is really customer satisfaction. What I really like about the VA is their trust report out of their Veteran Experience Office. And that, to me, that's one of the most important. If my goal is to reach 252,000 vets in LA County, we're not going to get there unless if veterans are coming to us, having the experience that they want, and telling others about it. And so for me, that's probably my biggest, what's on my radar to kind of do in the future is really kind of drill down on some of these customer satisfaction and model some of the stuff that the VA Customer Experience Office has done, Veteran Experience Office has done, and work on that. We, for suicide, Veteran Suicide Review Team, it's really, we're ahead of the rest of the country on this. I'm very proud to say that, but we're standing up a suicide fatality review team. And so basically everybody that dies in the county, the medical examiner goes out and investigates. For those that die by suicide, that data is sent over to the VA in my department. We take a look at the VA goes through a VHA system. We have the VBA, VBMS system. Take a look at who's a veteran, who's not. We get a list of all the veterans, and then we reach out to their next of kin to get permission to share their information. If they don't give us permission, we still aggregate the demographic data. But how we explain it to the family members is we're trying to make it to where no veterans dying by suicide in our county in the future. Mm-hmm. And this information will help us learn what are the trends so that we can allocate resources in a very precise manner. And, some parts of the country in general fatality review teams, what they found is, people giving their pets away at the local animal care control. And so what you can do with that type of information as you're learning those trends is target resources to your local animal care control. Everybody thinks that, 70% of veterans die by a gunshot wound with suicide. So everybody thinks of gunshots, right? But this information is going to help us kind of dig below the kind of obvious stuff and get to kind of where we can actually get more upstream in regards to suicide. So that's probably the best example of how we're using data correctly and really kind of highlight collaboration. We got 16 different county departments.
Yeah. You got to have everybody, all hands on deck, right, to get all that data.
VA, CalVet, which is our state Department of Veteran Affairs. We've got the FBI Social Media Forensic Task Force that's involved, so they can take a look at social media as well. So yeah, it's great and really proud of that work.
That is awesome. And one thing you mentioned, and we've heard it a couple of times on the podcast, is the trust piece. The fact that as veterans, that trust thing goes a long, long way. I just finished my transition, and all through the transition, and even while you're in the military, you hear how bad the VA is and this and that, and you see stories on the news. So it's great to hear these stories coming from you of what's going on out there in LA County, that that one, you're looking at the trust factor. Two, you're using these statistics in a powerful way. Because the giving away the pet thing, that's just an amazing avenue to take a look at. as an indicator. So love hearing that. What else? What else are you working on then as the Director of Military and Veteran Affairs?
Yeah, so I didn't know a lot about county VSO work, Shawn, prior to coming to this job, but I stepped into the role as the county veteran service officer for LA County. It's one of the hats that I wear, and really the fact that county VSOs are just one of the most underrated, unknown, and unfortunately unfunded programs in the country. Like I just, it's I think 29 states have county VSOs. So why we don't have all 50 states with county VSOs to really up the collaboration between county and VA and state, it's beyond me. I'm interested in it and I'm learning about it. So really doing a lot of work to uplift the work that county VSOs do and the importance of collaboration between county and VA when it comes to veterans.
That's huge.
Mm-hmm. Mm-hmm.
Yeah, especially with your PAC Act.
It's got to be just perceived need and budget, right? I mean, as far as the gap.
Yeah, I mean, I just think, from what I've seen, and I'm just speaking for the state of California, CVSOs really kind of see their role, and it might be because it's dictated by their board of governance, their county elected officials, really narrow. Like we do claims, and that's what we do. And there's just so much opportunity if, board leadership in different counties supported their VSO and allowed them to look for ways that we can save money. Counties love to hear that, by getting somebody enrolled in VHA that comes through our, in LA County, we call it Department of Public Social Services, but departments where people go to get federal, like food stamps and general relief. If we're identifying our veterans that are coming into those offices, we can get them on VA healthcare and get them off of county. And most veterans that I meet want veteran-specific care. Some, a few are hesitant to go to the VA, and we really work with them to like, hey, it's a different day. Like, let me introduce you to some key folks in the VA that'll make sure that you get what you need. It just the more county government supports their county VSO and broadens their scope, the more impact we can have for a county.
Yeah. I know we're getting down to time here. I did want to ask a couple questions on career transition, right? Because at the end of the day, the homelessness problem, some of the mental health issues, it all comes down to cash flow, right? I mean, when you boil it all down, it all comes down to cash flow. They just aren't able to, and for whatever reason, it might be internal, it might be external, provide for themselves. What are the county resources, right, for career transition, veterans that are, whether they're homeless or not, perhaps, but some of the resources to get help with that?
Yeah. So we, the board jumped on the opportunity to become a SkillBridge partner. So we have 40 different county departments, ranging from Parks and Rec, Beaches and Harbor, to mental health, health services, our sheriff's department. And we really, the county sees the SkillBridge program as the ultimate prevention program. Like really kind of those that are, somewhat drawn to continuing to be of service, working for local government, or maybe they don't know, which a lot of us fall into during that time. We want to give them an experience on their way out the door that really kind of, one, gets them understanding local government and the importance of being involved in local government, as well as access to county department leadership for informative interviews to learn more about what we do as a department, what they do as a department, and how we work together. And so that's what we're really trying to build. It's really kind of early stages of that, but that's really our major focus. We don't put all our eggs in one basket, though. There's a program called Onward Ops that we're involved in, where folks that are still in can sign up for Onward Ops and get connected to a sponsor in their local area that they want to go. And so, we're kind of pivoting from a volunteer model to actually me assigning one of my VSOs to touch base with people, because that's the other thing. VSOs are like the ultimate, like, first touching point. Like, none of us transition out of the military into a VA hospital, but we do transition into our community. And so having a community, a VSO in your county that you're going that, has enough staff, has enough bandwidth, is really important, because we can enroll you in healthcare. We can get your benefits going, like all that stuff. And so, you know, the original model of Onward Ops was to have, you know, volunteers, whether they're veterans or not, just people that care about the, you know, helping men and women that are transitioning out of the military. But here in LA, we're kind of pivoting to where we're seeing like the needs that they're coming to us with. And it's just, we want to bring our A game, and it's hard to kind of corral volunteers at times. We want to have a staff identified that can enroll them in the VA, knock out their benefits. And, you know, the great thing about county VSOs in the state of California is we also administer state benefits. So we're the only VSO that can sit down and do all your federal, and then also get you a tuition fee waiver for your kids to go to school for free at any Cal State or UC, stuff like that. And so we're really kind of, you know, putting some eggs in that basket as well.
Man, I tell you that was totally me. I mean, and I'm from Northern Illinois, right? And I was in a little town out process, and my hometown was a little town of 26,000 people, right? The county seat. And it was a VSO. That was you're exactly right. I mean, I'm a 23-year-old kid, right? Still don't know, you know, here from here, and had no clue. But that VSO took me in and said, here's what you need to do, right? Got me going with everything. So got my rating. I mean, I wouldn't have had a rating. I wouldn't have even done it if it hadn't been for that VSO.
Yeah. Same here. Similar story, except for I came to LA, so there's a few more than 26,000. But but yeah, somebody said you need to talk to this guy, and I talked to him, and yeah, same thing.
Yep.
Onward Ops sounds like a phenomenal organization. We're going to have to reach out to, I think, to bring on here. But I'm listening to you go through this, Jim. One, I'm just amazed by everything you're trying to do right there in LA County. That's amazing. You know, being in Florida, Mark being in Texas, we probably don't see a whole lot of good press about California. At least not coming out of the government, the state government, I don't think. But it's great to hear this stuff going on, and it got me thinking. Cedars-Sinai is in LA as well, and our good friend Jennifer works there as the veteran outreach coordinator. And her passion and what she's doing, it's just that there's some great things going on in LA County. That's just phenomenal to hear. Really like to see what you guys got going on there. So
yeah, some of the synergies, right, between the county and the other, you know, not just VSOs, but the other organizations like Jennifer and the groups that are helping.
Yeah, I mean, I just gotta say, Shawn and Mark, it's really people like Jennifer that's making this happen. You know, like I'm fortunate enough to make it to the point to where I got to see at the table with the local elected officials with the county. But really, you know, I tell people, like, if you're looking at me to come up with all the good ideas, like, we're gonna fail. You know, 95% of the good work that's coming up, it was somebody else's idea. I was the person at the table to kind of bring it up to leadership and get all the credit, but it's not. Yeah, there's a lot of great people like Jennifer. We have a really strong women veteran advocacy tribe here in LA, and those ladies really kind of bring the heat and make sure that they're not being forgotten. And yeah, it's just really good energy out here, and some just great people.
I love it. Yeah, I love to hear that the passion is there and the county is supporting it.
Yeah, absolutely. Our good friend Marina's out there in California as well with her.
Marina's.
So a lot of good things happening out there. Not enough to make me move to California, but a lot of great things going on out there. I'm gonna.
Who would be a good connection or partner for you, Jim, in the veteran? Well, again, VSO or just local community organization.
A good, sorry, Mark, for you guys to connect with, or a good?
Yeah, no. Who would be a good connection for you, and who's maybe one of your good connections that would be, a good guest on the show?
Yeah, God, there's so many. We got. Yeah. Let me put some thought into it. But yeah, I mean, we got Rocio Palmero that runs Women Vets on Point, which is a women veteran specific program that does great work. There's Amy Bravo, who runs the LA Veteran Collaborative. She's a Air Force veteran and still in the reserves. I mean, there's a lot. I mean, it kind of depends on who, if there's kind of a area that you want to focus
a
on.
theme.
Yeah, I think theme. Yeah.
Sure. All right. Any organizations out there that we might be able to help get you guys plugged in with, the county plugged in with?
We just made a strong connection with Wounded Warrior Project, so we're looking really forward to that one. That's been missing. Like I go to Houston, I go to DC, I go to some of these other communities, and they're really plugged in with Wounded Warrior Project. So that's been on my list for a while.
Okay. Yeah, you're in with Skillbridge already, Veterati, Vets to Industry, some of those.
Yeah.
National level.
Yeah, I'll have to put some thought into that, Mark. I really want to be strategic on that one. And right now it's a Saturday morning, so my brain is drifted into weekend mode.
We can do. Let's connect and comb through each other's connections.
You are in California. It's a little bit earlier for you than us.
Oh yeah, that's.
Yeah, I'm not going to complain about the weather to you guys, and I'm not going to complain about getting up after starting at after 08. That's a very generous start time.
All right, so we are coming down to the end here, Jim. What kind of assistance do you need? Like if people want to support the county, is there anything that they could potentially do? And the second part of that is what do you want to leave our audience with?
Yeah, so really where we could use some help is we got the LA Veteran Collaborative. That's just, it's over 100 I think our last meeting earlier this week, we had 140 partners on it. A lot of them are like, some representatives from the VA and the bigger nonprofit, leadership. We try to also get the people on the ground actually doing the work at the place as well. But we also have a large group of like smaller nonprofits that are just trying to figure out their way. They don't really know how to collect data and really kind of expand what they're doing and go for funding. And so what we're really wanting to do is create a innovation fund so that these smaller nonprofits, we got more nimbleness, because right now we have all these folks that are coming here and coming to the collaborative and telling like, this isn't working, we're missing this, we're missing that. For county, it's, it doesn't move quick. We're smaller than the feds, but it just doesn't move quick enough. And the flexible funding pools that are out there, the programs that have just general assistance, really, they don't focus on like funding $40,000 to a provider to make sure that veterans that are homeless with pets have access to food for their pets and veterinarian care. Yeah, I'm just throwing that out as a mock example of some of the quirky needs that county regulations then let us provide and federal dollars don't let them provide for folks. So that's one thing that we're trying to do. We're also trying to really create a speaker series. We really want to create a speaker series. So I'm in the beautiful Bob Hope Patriotic Hall. It's a building that was built in 1925 through some advocacy from World War I vets and Spanish American War vets here in LA County. We have a very rich military history, and we focus so much on homelessness, we focus so much on mental health and stuff like that, which is important, and which is the county's focus is making sure that we're the safety net for all of our constituents. But I'd really like to leverage the building to bring in like a General McChrystal or Admiral Mullen or stuff, and really kind of draw a lot of the veterans that don't really need a lot of the help. They're doing great. They're students at the USC, Masters of Business for Veteran School, or, doing really well. But, what's going to draw them is, a general coming out, a well-known general, or, a leader, Medal of Honor recipient. We have Medal of Honor Society close by. So we want to tap into them, but really kind of helping us, find the funding or get plugged into an organization that we can work with to kick off a speaker series. That I think to answer your earlier question, Mark, I think that would be helpful.
Yeah, man. I just heard that, and I just saw, down by the new Dallas Cowboys stadium and the new Globe Life Park for the Rangers, they're building the Medal of Honor, the National Medal of Honor facility here in DFW, Arlington. That may be something coming down the pipeline we might be able to help with if I can get some connections in there.
Cool. That's great. Yeah. Well, my good buddy Danny, who we served together in 114. We met when I was running that program. He got assigned by the VA to be the employment specialist for my 48 guys in that program. he's a big Dallas Cowboy fan. And that's how we actually got reunited by him working for the VA, getting assigned to my homeless program. And
okay.
He was like 114, like, because I had all my 114 stuff up on the wall. He was like, wow. But yeah, he's a diehard Cowboys fan. So I always like sending the cowboy, the anti-cowboy memes to him. And
yeah, there you go. You can send them to me too.
yeah.
But I'll see if that's something I can start looking into as far as maybe getting some ways to plug you guys in with some potential speakers.
The other thing I would think would be Boots to Books. Have you talked with them at all? Peter Klein?
No.
So they're based out of San Francisco. And he just his team put together this training series, and they had a whole bunch of people contribute to it. That might be a pool of potential speakers for you. Most of them are in the transition space somehow, talking about things with transition, but most of it's all geared towards veterans and things like that. So it could be a potential avenue to help you out, get you started.
Cool. Yeah, I appreciate that connection.
Yeah.
And then the other one I would, if you're not connected with her, I can connect you, is Marina, who lives there in, is it Temecula or something like that?
Temecula. Yeah.
She is a super connector. She's plugged in everywhere. She actually she's the West Coast, in charge of the West Coast version of 4Block, one of the transition programs. So she handles that whole side. So she could be another great person to link you.
Oh yeah. Yeah. You want to talk about a force in the women's veteran space too. Yeah. Marina.
Sounds like I should know her, and she should definitely know our tribe here in LA of women vets.
Yeah.
If she doesn't already, she probably does. But
I'll shoot you a connection or a message with her on LinkedIn, because I think she could definitely hook you up, and then I can also do Peter if you want. That way we can see if we can help you, and those guys are already somewhat local to where you are. So
yeah. Right.
Yeah, I mean, in the last part, Mark, you asked, I think it was you or Shawn, what do I want to leave everybody with? I mean, really, just don't discount county. You know, your county government, like get involved. Counties can do a lot for veterans. Veterans can do a lot for their counties as well. And quite honestly, the first thing that I was told when I started in the field is the best treatment for post-traumatic stress is a good job. And I just went through a master's of social work program. I'm like, no, of course not. It's cognitive behavioral therapy or something like that. And it really is. Talking about like getting veterans involved in county and a job where we're feeling like we're giving back. We're involved in something bigger than ourselves. Like for me, it's been really rewarding working for LA County, and I encourage as many vets as possible to come join the county team. It's like the good part of being an NCO in the military. Like, you take care of others, you take care of your people, you're taking care of your staff, who are going to take care of the 10.2 million constituents in LA County or whatever county you're in. And so that's probably the biggest thing I want to leave folks with.
Awesome.
Absolutely. Love it. Mark, you got any closing comments?
No, Jim, thanks for sharing. Again, I've had my experience with my local county, right, in out processing and the help and support that I got. But I agree. I think that there's a lot of people that could benefit that just don't understand what the county can do for them. And I'd like to see, more support, to your point, from the counties on some of these initiatives, especially with, areas that have such a large need, like LA, like some of the bigger counties that are out there, right? We all need the help. It's known, right? It's not like nobody isn't aware. We're all aware of it, but we need the funding. You need the funding. We need the support. We need the manpower too.
Yeah. All right. So, Jim, great sitting down with you. You have an amazing journey of what you had to overcome to get where you are, and how much you're giving back to the community is just absolutely amazing. Love what you're trying to do and what you're already doing, and wish you the best of luck there. We'll definitely link you up with a couple people that might be able to help your cause out there and help LA County. We got your information scrolling across the bottom, as well as the website for the MVA for LA County. Encourage all our viewers and veterans across the country, especially those in California, to check this out, see what they got going on, and really take a minute to do what you can to either get the services you need or support them in some way, shape, or form. Thanks for coming on today, Jim. Very excited for what you got going on, and definitely look forward to hearing more about it.
It's a pleasure, gentlemen. Thank you very much. Appreciate it.
All right. Thank you all for tuning in today. And remember, don't drown the sea of transition. Grab the VET S.O.S Lifeline.